Hi, everyone, and welcome. My name is Hana Rashidi. I am a research lead here at MQ Mental Health Research, and I'm really excited to welcome you all to the launch of the MQ 2026 Fellows Award. We know that many of you are joining us from different parts of the world, different time zones, so thank you for taking the time to be here with us today. Before we get started, a bit of housekeeping. This session is being recorded and will be shared with everyone who has registered as soon as the recording is uploaded on our YouTube channel. Please use the Q&A function to submit your questions at any time. We'll try to address all of the questions during the sessions, but rest assured, all questions will also be compiled into an FAQ document, which we will share along with the recording. The grant team is also available to support you. You can email us at grants@mqmentalhealth.org if you have any additional questions. Joining me today are Dr. Marisa Marasini. Marisa is Associate Professor of School Psychology at the University of North Carolina at Chapel Hill. She's also an MQ Fellow. Dr. Leslie Booth is our Patient and Public Involvement, Engagement, and Participation Lead here at MQ. And last but not least, Michael Bowers, Executive Director of EMDRIA Foundation in the US. We'll start with an overview of the 2026 Fellowship Program, covering aims, eligibility, scope, award package, as well as the application and the assessment process. And then we'll hear from Marisa, who will share her own fellowship journey along with some practical tips for putting together a successful application. Leslie will then provide guidance on patient and public involvement, and we'll have time for your questions in a dedicated Q&A session. Finally, we'll finish with an introduction to the EMDRIA and MQ Foundation Research Fellowship, which focuses on eye movement, desensitization, and reprocessing therapy. So who are we? MQ Mental Health Research is a global mental health research organization that is dedicated to transforming mental health through rigorous and impactful science. We're based in the UK. Our sister organization, MQ Foundation, is headquartered in New York in the US. We fund and we champion high-quality mental health research worldwide, and to date, MQ has invested more than £30 million in research grants and collaboration across 37 countries. Our fellowship program, launched in 2013, is one of our flagship initiatives. It supports some of the most promising early career scientists from around the world, and many of our fellows have gone on to make lasting contributions in the field. With that in mind, now let's take a look at this year's fellowship goal. So the aim of this fellowship are threefold. First, it's to support early career researchers at a pivotal stage in their journey. Second, it's to foster bold, innovative projects that push the boundaries of mental health science. And third, it's to help researchers establish independence, building their own research identity and leadership profile. So we're looking for researchers who are bold and ambitious in their ideas, who want and are able to deliver high-impact projects that have the potential to change how mental health is understood, prevented, and treated. We expect applicants to demonstrate a strong research track record, a commitment to collaboration, and a clear plan for meaningful involvement of people with lived experience in their research. The fellowship is open to applicants from around the world. Our scope is intentionally broad. We welcome projects across all disciplines of mental health research. At the same time, we've identified several priority research areas where we see urgent need and potential for significant impact. These include the mental health of children, adolescents, and young adults, digital and emerging technologies in mental health, eating disorders, suicide, and self-harm. So whether your project fits squarely within one of these areas or takes a novel approach in another area of mental health science, we would love to see your application. Separately, we have a dedicated funding stream focused on EMDR therapy supported by EMDRIA Foundation, specifically for applicants based in the US and Canada. We'll cover this fellowship in more details later in this webinar. So let's talk about who is eligible for this award. This fellowship is designed for early career researchers, specifically those who are 3 to 7 years post-PhD or equivalent higher research degree. Applicants should be able to demonstrate a strong research track record as evidenced by quality publications, early grant success, invited talks, travel awards, and so on. They must be based at a university, hospital, or research institution and are able to dedicate between 50% and 100% of their working time to the fellowship over the 3 years period. We welcome applications from researchers anywhere in the world, with the exception of those based in countries currently under the UK financial sanction list. And one important note is that applicants cannot hold another major source of research funding above £100,000 per year. This is to ensure that the fellowship is providing meaningful new support rather than duplicating substantial existing funding. MQ recognizes that careers are not always linear. So if you had career breaks, worked part-time, undertook clinical training, or had any other professional and personal circumstances that extended your timeline, these would not count towards the 3 to 7 year postdoctoral window, and you can request considerations outside this time frame. On the other hand, if you're less than 3 years post-PhD, but have at least 1 year postdoctoral research experience and can demonstrate exceptional achievement, you may also be considered. My advice is for you to refer to the guidance document. It explains how this flexibility clause works and see if it applies to you, and make sure that these conditions are well outlined in your application as well. So you have a section for that. So you have to make the case for why you should be considered outside the window. Now, what do we offer? Successful fellows receive up to £250,000, around $332,500 over a 3-year period. The funding can cover your salary for team members who will support the project, direct research costs such as equipment, consumables, open access charges, patient and public involvement costs, travel costs, and training and development costs, as well as animal costs. Of course, we expect a full breakdown and justification of the costs in the full application. We also know that these may change between the expression of interest and full application stage as you develop your proposals, and we take that into account. What we do not fund is indirect and overhead costs charged by the institution. So why apply? First and foremost, this fellowship supports your career development. It helps you transition from early career to independent investigator. Secondly, recognition, because being an MQ fellow will give you visibility within the mental health research community worldwide. Third, innovation. So this scheme is built to encourage high risk, high reward projects that may not easily find support elsewhere. Fourth, for the community, MQ fellows join a network of peers and alumni who share a commitment to tackling mental health challenges. And finally, impact. We place a very strong emphasis on impact on research that benefits patients and the public and include their voices, and we will support you in achieving this as well. Now, key dates to keep in mind. Expression of interest will open on the 3rd of November and close on the 12th of December 2025. Applicants will receive a shortlisting notification in Feb 2026. Full proposal submission is due by the 3rd of April 2026. And instead of interviews, selected applicants will be asked to provide a video response to reviewers' comments. That will be due around end of June, early July 2026. And then we have the final decision, and we're aiming to have that by July or August next year. The application process itself is straightforward. You'll start by creating an account on MQ's online management system, FlexiGrant. The application form will be, you can find it online once it goes live, so on the 3rd of November. You'll then complete sections on your applicant details and personal statements, provide a project overview and scientific abstract, and outline your plans for patient and public involvement. You will also be asked to provide information about your track record, including grants, awards, and publications. Applications are then assessed by our funding committee, which include leading international experts, across mental health disciplines, as well as lived experience experts. We evaluate on four main criteria: the skills and the potential of the applicant, the quality and the originality of the project, the potential for impact, and patient and public involvement. So that's it for the overview of the Fellows Hall. I'll now hand over to Marisa, who will share her fellowship journey and some tips. Over to you, Marisa.
Thank you so much, Hala. It's a delight to be here. My name is Marisa Maricini, and I'm an associate professor in the School of Education at the University of North Carolina at Chapel Hill, and I am in my third year of the MQ Fellowship. And so I thought I would just start more with describing my journey in towards seeking out this kind of fellowship. I am a suicide prevention researcher, and at the time of learning about this opportunity, I had begun to build and test a virtual reality intervention that we were delivering to kids who were hospitalized for suicide-related crises. And I'm really interested in the intersection of technology and the context in which we're delivering interventions and how they can be mutually beneficial. So in this case, virtual reality could enhance the interventions that kids are receiving while they're hospitalized for suicide-related crises. And it could also address some of the constraints of our inpatient settings, which are under-resourced and rarely have skilled and trained clinicians available to deliver a wide range of psychosocial interventions. And as I was engaged in building this intervention, we were getting feedback and input from lots of teens. And our teens loved the idea, but also continued to voice concern for the need for it to address lots of different experiences and backgrounds. And so the idea behind our intervention is that it teaches kids therapeutic skills, and then they practice them in an immersive experience that's designed to mimic real world stressors. And I really wanted to find a way to partner with these teens who had amazing ideas and add more scenarios to our interventions that specifically met the needs of some of our more underrepresented and vulnerable in terms of suicide risk. And so when the MQ fellowship opportunity came out, and it was really focused on mental health, it was inclusive to digital mental health interventions and had a focus on PPI. I kind of had an aha moment and decided to apply for this fellowship so that I could learn how to better partner with teens with lived experience and expand this virtual reality intervention that was just getting started. So the opportunity itself really helped me think about creative ways to make this intervention better, to be able to test this intervention and to be able to centralize the voices of kids with lived experience. And so what I proposed to do involved both receiving mentorship in participatory co-design and then also building and testing new safety protocols to work with kids with lived suicide-related experiences, ultimately partnering with these teams to build and test new iterations of our intervention and then pilot this intervention in a clinical trial. And, the idea really evolved as I wrote the proposal. So I had some ideas in mind, but as I sort of followed the guidance, I thought a lot more about participatory co-design and how I had limited training in that area. And when I was writing my letter of intent, started to contact both MQ, but also other researchers that I knew to try to build out my network so that I could better understand who could support me in this process. I understood also that PPI can mean a lot of different things. And in my case, I really wanted to centralize it for my proposal. And there isn't a precedent in the United States to really engage in participatory co-design with young teenagers who have lived suicide-related experiences. So a big part of my proposal was not just on the research, but was also on building the protocols that were needed and testing the protocols to be able to engage in this kind of work safely. And so I just want to spend a couple of minutes telling you, I tried to reflect deeply on what it was like to both apply for this and what it's been like since receiving it, and try to come up with some insights that might be helpful for those of you who are excited to apply. And I really would encourage you to read the guidance carefully and also reach out to both MQ and your networks to try to build a proposal that's really strong. And the first thing I started reflecting on was sort of this range of 3 to 7 years of postdoctoral experience and what that means. And I think, having received this award and also met other fellows over the years, it really means that you have some established research, and you just need a little bit more to launch yourself into that next stage. And so at 3 years, I think it's going to look really different than at 7 years. And so I was on the 7 year end. I think I was exactly at 7 years when I received this award. And I wasn't actually sure that I would be competitive for it because I felt like I was broaching that mid-career, but it really was wonderful timing for me. But likewise, I've met others who were on the 3 year end and had some seed funding or had some ideas that they were starting to build, and then this fellowship really supported them into the next stage. The other thing I wanted to talk about is what PPI can look like for your research. And what I've proposed to do, participatory co-design with teens with lived experience, teens who've been hospitalized or seen for a suicide-related crisis. It is really central to what I'm doing. But I know that that's not the case for a lot of folks who are applying for this kind of award. And I just really want to say that that's, from my experience, when meeting other folks, it's really okay. The idea is to think creatively about whatever it is, whatever research you're doing, how you can integrate people with lived experience into that work. And so that's going to look really different for everybody. So just because I'm presenting on having it centered to my project doesn't mean that necessarily someone who's using secondary data analysis, for example, is going to think about it the same kind of way. But there really is a way to enhance research with lived experience voices, no matter what the approach is. And I talked a little bit about how I focused on mentorship, but I would really think creatively about this. Since I was on the 7 year end of this, I had an established network of mentors, but I had this gap in my research. And so I did really have to seek out other individuals to get that mentorship and participatory co-design. And one thing that was really exciting for me as a US-based researcher receiving UK-based foundation funding was that it opened my eyes to sort of the global research world more generally. I'd been pretty focused on what was going on in the United States. And I met a lot of folks, especially in the UK, who were able to provide mentorship to me to participatory co-design. I allocated funding towards my own effort because I needed to be at least 50% research and of course staff. And I've learned over the years that I needed to rebudget for things that I forgot about. So for example, research expenses related to the co-design process, some of the tools and software that I need to engage in that. Also open access fees for publications were really important, and travel to engage in my networking with mentors. I'm going to skip to the bottom bullet and then I'll swing back to MQ. It's a relationship. So for the last bullet, I would say, as someone who was applying for this funding outside of the UK, that if you are like me, just allocate extra time to make sure that you're getting your numbers and dates in the correct formatting at the last hour. I had multiple times where I'd set the dates up based on the UK formatting, and then my internal research team would switch them, and it caused a lot of confusion. And so you will have to take a little bit of extra time to have that detailed eye when you go through this. And in addition, as you read through the guidance, there's usually a direct parallel to however something is described in the UK versus where it is that you're doing your research. So the words might not always be exactly the same, but I was oftentimes able to come back to the same kinds of data safety and monitoring board and things like that. And then the final point I really want to make is that I really encourage you all to apply for this. It's been a tremendous opportunity for my growth as a researcher and also for networking and connecting with other researchers. And I think, Hala mentioned that multiple times in her presentation earlier. But my experience has been that I have benefited so much from the actual relation connections that MQ has provided. So I've presented to the board. I've presented in New York and in London, and I've been able to really meet a lot of like-minded researchers who are also doing radically different things from myself, as well as people in the world of tech and commercialization and innovation. So it's really broadened my network in a way that's benefited me. And an example of that is, MQ offers lots of other opportunities along the way, and I participated in a program with 3B Impact, where I thought more about commercialization of my intervention. And it's something that I truly never would have done if I hadn't already started down this path with MQ. So I am at my 10 minutes, and I'll pass it to the next slide.
Thanks, Marissa. What I'm going to do today is just take you through a very rapid aid memoir with regards to PPI. And I want to reiterate what Marissa said, is that PPI needs to be pertinent to your own research, but I thought it would be useful to take you through some of the guiding principles with regards to PPI today. Okay, so what is PPI? It's actually putting people with lived experience at the heart of your research project, because what people with lived experience can bring is help support your research ideas, what you're trying to achieve, what research gets done and how it's carried out, and actually how the results are shared and applied in practice. So I'm going to go through the terminology now. Involvement. Involvement is research done with or by patients and the public, not to about or for them. We are guided in the UK by the National Institute of Health Research that produce these guidelines and this terminology. So examples of good public involvement include bringing people together with your research team from a lived experience perspective to ensure that your research question answers where they feel and expect this research would give greatest benefit. They can act as joint grant holders or co-applicants within a research project, and they can help you identify your own research priorities. Engagement is very much about communication. It's about raising awareness and sharing research knowledge and findings. People with lived experience are great at actually acting as positive advocates for your research, and are often very willing speakers at events and conferences for you. And also recognition of the input and insights that they gave to your research is extremely important when contributing to academic reports and publications. Participation is very much when you look to bring people with lived experience into a room, whereby you're wanting to gain their insights, which will help add value to your research findings. Or it can take a variety of different formats, such as completing a questionnaire online, taking part in a clinical trial, and trialing new drugs or treatments at home. And we at MQ are very clear about the importance of lived experience and the insights that people with lived experience, relevant lived experience, can bring to your projects. And we advocate that lived experience should be throughout the entire life cycle of your research project. Lived experience people can help shape your research. They can co-develop your research questions and priorities. They can help with the study design and ethics review. They can also help support you on any recruitment strategies for focus groups, for example. And they also are adept at ensuring that there is easily accessible communication of any of your research findings. And also they can help shape policy recommendations. So as you can see from this list, lived experience really is at the heart of everything that you should be considering within your research project. And why does it matter? And it really does matter, because for a lot of people, they don't actually understand what research is and the importance of research. And it helps break down those barriers to understanding how important research is and how important they are to the research process. It also brings relevance to the research because they help to shape what will be meaningful and to help support potential patient benefit. And also it's all about empowerment. You know, involving people with lived experience enables people to contribute meaningfully to help address the power imbalance between researcher and patient or member of the public, and actually to improve both research outcomes and patient healthcare outcomes. And why does it matter to you? Well, actually, hopefully, by including lived experience, you will have better science, you will have a better research project, you will have a research project that is meaningful. It will also help you improve recruitment and retention to focus groups, online surveys, questionnaires, or in other ways that you wish to involve lived experience. And I think also inclusion and diversity within your project means that it's more an ethically rigorous practice. And of course, funders, and including people like ourselves at MQ, want alignment to show that by using and working with lived experience, knowledge and insights, you've got high quality, accountable research. Okay, so some considerations. You really do need to be realistic about your PPIE, and you need to think about what it is what is needed for your research project. So therefore you need clarity of purpose. Be clear on what it is you want from your PPIE, and don't be over ambitious and unrealistic in your approach. As Marisa said, PPIE can be extremely creative, and that's what we're looking for. We want it to be proportionate. Think about what you need from your lived experience input. Who are the relevant stakeholders? What experiential expertise do you want? And also, meaningful engagement. What you want is to involve people with lived experience as partners, as equals, working with you to help support your research. And how might that look like for you? Inclusivity and diversity. How will you do this? How will you include diverse and inclusive voices? Are you working with specific communities, for example? Practicalities and supports. What types of resources do you have to support your PPIE? What is your timeline, and how often will you see expert insights? These are all things you'll need to think about carefully. And also you need to think about the power dynamics. How will you try to be inclusive and acknowledge all the voices in the room? How are you going to drive that co-produced approach and foster cross-project learning? And then finally, evaluation and feedback. How will you actually track your PPI work to remain accountable to your plans? How will you use this to measure the impact of PPIE in your project? And how did your PPIE help to identify and value its influence in your research? I would ask that you just start to think about that. And finally, you will have help in all those thoughts and areas that I've just given to you. We do have MQ, supporting capacity, training resources and guidance to help strengthen your PPI in your work. You will not be left alone. We do have guidance, best practice and one-to-one advice. We're here to help you because we want your research to be a success. And we also have a network of experts, academic experts and peers who will also be able to share insights and approaches, because at the end of the day, we want to fund the best research with the best lived experience.
Thank you, Leslie. That was great. Now on to the Q&A session. We have many questions, so we'll try to get to as many as we can, but bear with us. Okay. There are a lot around eligibility, so I won't go into every single one of them. This will depend on each case-by-case basis. What we can say is, if you've had any career breaks, again, any form of training where you did not have an active research role during that period, they would not count to your 3 to 7 window. That being said, that the 7 is still the cut-off point at that stage. So you cannot exceed the 7 years. You just have to make sure that you're accounting for these career breaks when you count the years of experience, postdoctoral research experience. On the other hand, again, if you have less than 3 years postdoctoral research experience, then you will still be considered for this application. There are no guarantees. What we want to see is that you are able to compete with the other applicants, that you have significant achievement, and what that means is that should be demonstrated in the publication. That should be demonstrated in any signs of independence at that career stage. And we do outline what that looks like in the guidance document. So again, my advice would be to read through the guidance document and see if it does apply to you, and make sure that that is included in your application, because then the panel will be reading this and you are making a case for that panel about why you should be considered for the fellowship. So focus on making that case, why you're able to compete if you are not meeting that threshold, and on the other hand, why your break should not be counted towards that 7 years experience, but also what have you gained and what have you done during that time. If it's for personal reasons, that's completely understandable, and that is why we've included that clause as well. What other question? I think Leslie and Marisa, feel free to jump in as well at any point in this. Would projects that span 2 or more areas be more favorable? What we would say is it's very hard to know depending on the project. So it's not something that we are already declaring and what we'll tell the committee, these are amazing, they will score higher. But what we can guarantee is MQ is committed and welcomes and encourages interdisciplinary research, collaborative research. And in that aspect, yes, they are. And we want to see more of that research that is cross-cutting across different disciplines and areas, even outside mental health. We want to see more collaboration. And for that, in that way, yes, they are favorable. Do we have any upcoming applications for potential postdoc funding? None that are live. We are working on a few, so there are floating schemes, but none that are confirmed or live at the moment. We did have a scholarship program that is dedicated to researchers that are 1 to 2 years into their postdoctoral research, so at an earlier career stage. We've offered different kinds of grants over the years, but at the moment, none that are live, but doesn't mean that we're not working behind the scenes on a few. I'm trying to skip over the research experience questions. Is there any flexibility in the eligibility criteria or in the time that is committed? I think it's a twofold question. So in terms of the eligibility, I think if it's included under the flexibility clause that we've added, yes, we're happy to consider the applications, although there are no guarantees that what the committee will decide on. In terms of the amount of time dedicated to the award, it will have, again, we can have a look at that, but the reason why we put 50% to 100% is that we do expect you and we want to ensure that there is sufficient time dedicated to this fellowship. It is something that you are going to be assessed on as well. Are you able to deliver on this? Have you allocated sufficient time? Is this project that you're proposing feasible given the time allocation? And in that way, I can sit here and say, yes, you can apply and build an application, but we don't want you to waste the time if it will not get through. So you have to consider what's the proposal that you're proposing, what is the project, how much capacity and resources it will need in order to prove and make the point in the case for it to be feasible, because that will be assessed. So it's not a matter of percentages or number, it's ensuring that you are able to put in the time for this fellowship, to dedicate sufficient resources to this fellowship and make the case for it for the committee. Are projects conducted as collaboration between 2 universities, one in the UK and abroad supported? Yes, they are. What we do need, though, is one leading institution that we can have the terms, the contract with, and then another agreement between that institution and the other institution wherever it's based in the world. It doesn't mean that the UK-based institution will be the lead on this. It could be the other way around, depending on the arrangement at that place. But we do encourage cross-country collaboration. We do encourage this form of working. We just have to make sure that everything is set in place. It becomes more complicated when we are dealing with different institutions at the same time. And so we've tried to make it that our contracting obligations are just between us and one institution. And then you can outsource and you can have another contract with the other institution. I'm definitely skipping questions here, but let's see. There are some questions about the salary support and that restriction. I mean, in all honesty, we do have some flexibility, but again, it's ensuring that you can allocate the time and the resources for this fellowship, that that this money is going to a place where there is need, a new project that's being delivered, and not just replicating or building on funding that is already out there, because we know that the need is great. We know that we have had more registration for this webinar than any other webinar before in our fellowships. It's because the funding landscape is changing. There's a need now more than ever. So if you are one of the lucky investigators who have funding secured for your projects, unfortunately, you would not be eligible for this particular fellowship at this time. Leslie, I found one for you.
I've got a couple that I've seen, yes.
Brilliant. So the one that I found, but feel free to also address the others. Are there opportunities to work with MQ to involve patient PPI in co-developing the fellowship application? Or is PPI funding online available after it is awarded?
So we would expect you to start to think about PPIE in the application process. And we're here to give you some guidance on that. And we would expect to see in your application process what that PPI could look like, what you're envisaging, and we can certainly support you with that approach. I've had a question about advice for postdoc fellows coming from basic research with little to no experience with PPIE. And how would you go about that? Well, we at MQ encourage you to talk to lived experience people right from the outset. And I know it can seem daunting, but the best thing you can do is take the kernel of your idea, your research project, to some people with lived experience and elicit their feedback and feel confident about doing that. Because they will help you most definitely shape your application and your research going forward. And the other one, I think I've probably answered this, is do you expect PPI involvement already in the application process or only once fellowship is granted? Ideally, we would like to see it in the application process, because it's the application process that's going to shape your research project if you are awarded. So to demonstrate your thoughts at this stage and how you're going to include it and to talk to people to check that it's pertinent and relevant is a great starting point. So I hope that's helpful.
Marisa, any other comments from your side before I delve into more questions about the fellowship?
Yeah, I put some answers in because we can answer them through chat. But just to answer a couple, that I put a link in for where you can see previously funded research projects. And I highly recommend for those of you who are trying to think creatively about PPIE, and if you haven't done it before, to see how others have integrated it. And that when you're thinking about selecting a mentor, that absolutely your mentor doesn't necessarily have to be local. So please correct me if I'm wrong, but that was not the case for me. I was able to maintain existing mentorship relationships and then also build from them and sought out mentors in the UK. So if that worked for me, and that was great. And then I think there were a number of questions more about like if you have I feel like the rest I'm going to go out of my depth if I try to answer them, because I have my experience and I don't know if it's right, so I'm going to leave it there.
There are some questions about the research institution and if it has to be an academic research institution, to which no, any other research institution is acceptable for this fellowship call. There's one about if PPIE individuals need to be named, and it says that they work closely with lived experience groups but won't want to burden them with a signed 3-year commitment on MQ. Would budgeting for unnamed input from a dedicated panel be sufficient? Leslie, do you want to take that, or me? But of course it is.
For your application, no, you don't need to name the people with lived experience. Going forward, you have the option, well, of course, you will need to know them because they sort out payments. And also you can ask them if they would like to be named in any publications, and often they will make that choice themselves as to whether they wish to be named or not. But for the application process, no, we just want to know that you're using relevant lived experience members to support your research and how you're going to be using their skills and knowledge and insight.
Does MQ Fellowship accept working on non-clinical research or translational research on animals? Yes, we do. This is open across different disciplines and translational level of research, so that's definitely something that we accept for this fellowship. In terms of having co-PIs, the fellows allows for only one primary investigator per fellowship. You can name collaborators, but unfortunately, we do not have a co-PI for the fellows. What is the earliest start date? In terms of start dates, we expect September 2026 to be the start date if we are on track and we have the decision in time. And again, then we have to have a contract with the institution. But all things considered, we're aiming for September 2026 as a start date. You do have we offer some 3-month flexibility usually to allow different applicants, as they start their proposal to set up and get ready for that project. But let's aim for September 2026. There's a question regarding salary. Next year, I should hopefully be a consultant. The award may not cover my salary for the 3-year award. And can you seek salary costs elsewhere? Yes, definitely. We have seen that as the MQ award progresses over the year, and this is what we want to see, is for you to be able to get more grants and salary support. What we've noticed with our own fellows is that that amount that is allocated towards their salary becomes less, and in time they're starting to support more staff members, they're starting to expand their team, and that is actually something that we want to see and we encourage as well. Do you have to add mentorship activities as part of the application? It's not a requirement. And it's something that MQ is happy to support for the awardees. We do expect some sort of sponsorship. Now, whether that's an official mentor or other supervisory role, but we do want you to be supported for this fellowship, and that is a requirement. But that can look differently in terms, even for different institutions and for different countries. And so what we want to see is that you have that role within supervision and someone to support you, someone more senior to support with your fellowship. Does MQ, and this one's for you, Leslie, do we prefer applications from researchers who are already adept at PPIE and have strong systems set up for doing so already? Or is there more interest in helping to facilitate new PPIE projects for researchers who do not yet have experience with patient and public involvement?
Ooh, that's a very good question. I think at the end of the day, it is the importance of the science and how the science will be supported via PPIE. So we recognise that some of you will come to the awards table, as it were, significantly experienced in PPIE, and there will be others that aren't. And we do not discriminate between those with excellent experience and those that are just learners. We want the PPI to be reflective of your project, and that's what we're looking for. Really meaningful, good quality, carefully thought through and creative PPIE. So we welcome applications for both those very experienced and for those with less experience, but really wanting to learn and join the PPI family.
And we have time for one more. And just noting that we will address all of your questions. We'll include them all in the FAQ document. We'll get back to you. But there's a question around the cap on the research funding. And if it means that never have received this amount, no, we mean when you're applying during this period, the awards period, if you have received this funding at this time that you're applying, covering the Fellows Award period, which will start in September 2026, you should not have a funding simultaneously during that period. Again, we will address these questions in the FAQ document. There are many. And also, we are available to support you. Again, you can email us with any additional questions at any time, grants@mqmentalhealth.org. And Just note that many of these are actually addressed in the guidance document. We didn't have much time during this session to go into the details and the criteria and these clauses, but they are outlined in the guidance document. So do visit our fellows page and do go through the guidance document. And then if you have any more questions, we're very happy to support. Bryony, if you can start the presentation, I'll hand over to Michael Bauer, who is joining us from the US and will introduce us. Michael is the Executive Director of EMDRIA Foundation. They are supporting the EMDRIA and MQ Foundation Research Fellowship for US and Canada-based researchers. Michael, thank you so much for joining us. I'd like to take the lead.
Okay, great, thank you. First, the EMDR International Association Foundation is a relatively new entity. It is affiliated with EMDRIA, which is the EMDR International Association, a membership association for mental health professionals who practice EMDR therapy. EMDR is an evidence-based mental health treatment for PTSD that is included in many international clinical guidelines as a recognized and even preferred treatment for PTSD. However, what we want to do in this fellowship, with these fellowships, is to strengthen and expand the research capacity for EMDR therapy in the United States and Canada specifically. There's a fair amount of research that happens internationally. We want to build more capacity in the US. And our goal, obviously, is to create a new generation of trauma-informed mental health researchers who can contribute to evidence-based clinical guidelines that inform health policy and then ultimately health coverage and, of course, affects access to care. Overall, this will be we are offering the possibility of 4 fellowships. It will be eligible to scholars in the US and Canada with the same basic criteria that has already been spoken about here for MQ. We're looking to develop early career postdocs. Prior experience with EMDR is desirable, but it's not essential. As we'll talk about in a moment, we have some groups of researchers who are international, based in Australia, the Netherlands, and the UK, and some in the US, who have offered assistance with research design or with working with EMDR, learning how to do research, clinical research in EMDR as a part of this, as folks consider moving into this work. We're focusing primarily on 2 diagnostic categories in this particular call, and we look forward to expanding that in the future. But for now, the focus will be on post-traumatic stress disorder or on depression. For those who are focusing on PTSD and who want to submit a proposal on PTSD, there are several target populations that we want to consider: military, veterans, law enforcement, first responders, children, indigenous populations, and then, of course, civilian trauma survivors more generally, with the appropriate criteria being met. So it's pretty broad in terms of the populations. We would be interested in some of these populations being studied specifically, but it is also focused more narrowly in the diagnoses that we want to study EMDR in clinical research. The eligibility or understanding how apparently I've skipped a slide here. No, it's okay. I'm looking at notes over there and I'm doing this here. What we want in a proposal is for you to talk about how you will advance the understanding of the effective application of EMDR therapy. We want to know how it works. We want to know if it works. We want to know what makes it better, what results you find. And in the context of studying EMDR, to show a critical engagement with the existing theoretical, empirical, and practice-based frameworks for mental health more generally. We want to look at gaps. We want to look at methodological innovation. We want to look at the clinical utility of EMDR. Obviously, we would hope and provide support for dissemination to academic and public audiences, and we would want to see a plan for that as well. I mentioned a moment ago, there is a significant body of EMDR researchers. There has been, prior to the pandemic, and we worked through the pandemic, a group of about 40 or 45 international scholars who were doing work in EMDR. A group of those has continued on and continued forward in a number of ways, studying depression, studying PTSD, building the research base for EMDR therapy. And you would be joining a group of people who are most interesting. We just finished the EMDRIA conference with 1,700 practitioners and researchers in California. The reason I am speaking today is because all of them are on planes on the way home. Otherwise they would be here to be much more articulate. But we're looking, there is a community of folks who are open and wanting to work with new scholars in building this trauma-informed research capacity and the utility of EMDR therapy. They are interested in helping to support with mentorship, dissemination, if there's guidance on IRB or ethics, if there is work in developing other kinds of partnerships. And I would say also specifically in the design of clinical approaches utilizing EMDR therapy, because we know people may not be familiar with or fluent in the treatment approach and in the treatment. And we want to provide support from the beginning to the end as that is needed to make sure that there's an understanding of fidelity as a manualized treatment and the theoretical underpinning of EMDR therapy. There's a group of folks who would be willing to work with you who are very skilled in doing exactly those things. That's really the gist of this. There will be four fellowships offered. We are excited about moving this project forward, and the community would welcome you very much to be a part of it.
Thank you so much, Michael. Closing remarks here. First, I would like to thank the panelists, Leslie, Marisa, and Michael, for your contributions today. Thank you. We are aiming to award at least 10 Fellows Awards through this Fellows Call, including 4 for EMDR therapy. Thank you for everyone who's joined us today. We hope that this session has given you a clear sense of what the 2026 Fellows Award is about and how to put forward a strong application. We look forward to receiving your proposals, and on behalf of the panel and everyone at IQ Mental Health Research, thank you and good luck with your application.